Really, in May, it wasn't unusual for 700 hospital beds to be occupied by patients suspected or confirmed to have COVID-19.
But while the number of people needing treatment went up at a Thornton hospital, staffers say the number of doctors and nurses did not. Here's Jessica Porter.
A patient being treated for COVID-19 at North Suburban Medical Center in Thornton died in May, not from the virus, but because there was no nurse available to change the battery on the machine measuring blood oxygen levels.
This person went without monitoring for more than 45 minutes just because nobody had a minute to be able to go and change the battery.
Megan Wingeter with the Denver Post interviewed doctors and nurses at the hospital. Those employees spoke anonymously out of fear of losing their jobs.
They're being asked to do more than they feel comfortable doing, and there's the concern that is then leading to harm for patients.
When an oximeter isn't working, technicians are required to alert a nurse until the problem is fixed. The technician notified staff of a problem at 5:35 p.m., again at 6:12. 10 minutes later, a code blue was called for the patient. The nurse told inspectors she had a busy patient load and the unit was not staffed appropriately. The technician was monitoring 47 other patients and said it was often difficult and hectic.
That seemed like a red flag kind of number. Now, I mean, of course, depending on the situation, there's not necessarily one, right number, how many patients you can take care of.
Doctors and nurses told Wingeter that patients are waiting for basic needs like meals and help getting to the restroom.
They are not getting prompt care, going to get up and try to take care of things themselves and possibly fall and injure themselves even worse.
In a statement, the hospital says in part that they worked with the health department on a, quote, action plan to address the issues, and after a follow-up visit, they were found to be in compliance. Jessica Porter, Denver 7.